At the moment, as of this morning, there's 83 active cases in Shepparton related to the COVID outbreak that's now been in place a little over 3 weeks. In the last 24 hours, there's been 0 new cases, and in the 24-hour reporting period prior to that, there was 1 new case, and that was a known household contact and linked to an existing person who had tested positive previously. So that's really encouraging, and of course we're pleased to see those numbers beginning to trend down as a result. So far, in terms of the total number of people that have been cleared, in terms of people that had been active cases of COVID, of course they'd been diagnosed with COVID. So far we've cleared 61 people as a result of the work by the contact tracing team and the medical folks that have been able to clear those cases, and of course they've all been released from quarantine. In relation to the number of contacts that are being monitored, that number's still in the order of around about 500 to 550 contacts are still being monitored. So there is still some processes that are being worked through in terms of clearance testing and monitoring of people, of course those active cases and their contacts that our clinical staff are continuing to undertake. At the moment, in terms of inpatients at GV Health, there's 4 people admitted with COVID-19. In recent days that's been over 10 at certain times, but we're well prepared and able to care for people in that respect who might require not only care in our emergency department, but in terms of care in our inpatient wards as well. So COVID is still active in the community, as we know. There's a number of people, as I mentioned before, so at any time that people have any symptoms of COVID, no matter how mild they could be, we want everyone to come forward and get tested as soon as possible should they develop any symptoms. Symptoms can be cold and flu-like symptoms, but we are seeing some people that have nausea, vomiting and diarrhoea on occasion, so don't dismiss those symptoms as something that that's not COVID, because we are seeing people with the Delta variant that have those types of symptoms. In relation to vaccination, we're still continuing our efforts. This week, of course, we're focusing on Year 12 and level students as part of the blitz that is happening statewide. We've seen some pleasing moves in regards to the number or percentages of people who are vaccinated in the Shepparton local government area. So in terms of people who have had their first dose, it's now 64% and 37% of people who have had a full course or double dose of the COVID vaccine. So again, on that front, we're really encouraging anybody who hasn't booked their appointment to be vaccinated to please do so. All of the state-based hubs can be accessed at coronavirus.vic.gov.au or 1800 675 378. So please, if you haven't already booked an appointment, take up the opportunity as soon as possible. But also there is good access to vaccination in general practice clinics and also and pharmacies, which are soon to open up their vaccination campaign. So thank you, and happy to answer any questions.
Is it a good morale boost to be out of the day where we've had no new cases in the last 24 hours after the last few weeks?
It is certainly encouraging in terms of that we're 0 cases in that 24-hour reporting period is really pleasing, and also being able to clear a number of cases as well and see the overall number of active cases starting to reduce. Hopefully that trend continues, and we might be in the order of around about 50 or 60 early next week, all things going well, barring any unforeseen spot fires or the like occurring, but that's the trajectory hopefully we can continue in the coming few days.
Earlier in the outbreak, you used an analogy of a football match to describe this outbreak, and you warned us that we weren't at half time yet.
Yep.
If we are in a football match, which quarter are we up to now?
Yeah, well, I think that's a good one. It's probably in the 3rd quarter, and as people who have played netball or footy, the 3rd quarter is the premiership quarter. So I think what's really important on that front is that we don't throw out the good work that's been done across the community in the last 2 or 3 weeks, particularly those little things about as I mentioned before, as soon as you've got any symptoms, no matter how mild they are, come forward and get tested straight away. But also all of those important things about monitoring the exposure sites, wearing a mask, hygiene, sanitising your hands, all of those things, that's what's going to get us through to the final siren, not three-quarter time, but right through to the final siren. And again, anyone who hasn't been vaccinated, that's where the big push is, and that's what really is a big team effort from the whole community from that perspective. So if you haven't been vaccinated, please make an appointment as soon as possible.
And just to clarify about the 500 people who are still being, approximately 500 who are still being monitored, does that mean that they're in quarantine?
Yes, yes, they should all be in quarantine. Yep.
That's it from me.
I guess with obviously the government's announced that we hopefully will come out of lockdowns next week. Is that will be pleasing news for the communities who worked so hard to get us to this point?
Yes, and really it relies, so it is encouraging to see certainly all of our colleagues in regional Victoria now coming out of having eased of restrictions from midnight tomorrow night. That's terrific news for them, and certainly, you know, hopefully if things keep continuing in the same direction for people in Shepparton in terms of the outbreak, we'll be there, you know, maybe in the next week or 10 days perhaps. But it really, again, to get to that point, we've got to reach that final siren that we were talking about before, and all that relies on people continuing to do the right things, continuing to follow the directions, and just working really hard as we finish this off in terms of you know, bringing to an end this current outbreak that's been in Shepparton.
And I guess it's that need to not get complacent thinking that we are almost to the end.
Yeah, definitely not. We're still, as I said before, using that football or netball analogy, we're about halfway through the premiership quarter, so you know, partway through the third quarter, we're not there yet, and we just need to working really hard, both individually and collectively as a team and as a community, to really break the back of it and come out with a victory in the end.
In terms of testing capacity and stuff like that, is there any plans to start winding that back soon, or will that stay as it is at the moment?
Our testing capacity for GV Health sites is at the Acute Respiratory Clinic here at Graham Street, but also the drive-through site at the showgrounds. We're testing around about 250 to 270 people a day. So we'll continue to keep those sites open. Certainly the respiratory clinic here will remain open for months to come, I suspect. We'll reassess the showgrounds site, but for the time being, we're happy to keep that open, but we'll review that every 2 or 3 days.
And in terms of the ADF, are they still around and offering help at the moment?
The ADF folks that were, or the deployment of 40 or 50 people that we had for the testing effort, have now, they packed up and have headed out of town as of yesterday and today.